What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at our Adenta new site behind the CAF International School opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center. Excellent healthcare, our hallmark.
Hello, welcome to the Zoe Health Talk Show. My name is Dr. Fiao from the Zoe Fertility and Alternative Medical Center. The Zoe Health Talk Show is a health education program which comes your way on this platform. We discuss various health issues and various conditions that may be affecting you. Today, we want to talk about recurrent pregnancy loss. Recurrent pregnancy loss. Recurrent pregnancy loss has to do with the loss of 3 or more consecutive pregnancies. One of the challenges that couples face, apart from a case of infertility in some couples, is that sometimes some couples have the challenge of having difficulty maintaining pregnancy to full term. And so when a woman gets pregnant and she loses the pregnancy in 3 consecutive times or more, that is recurrent pregnancy loss. Sometimes we term it as recurrent miscarriages. And there are various causes that lead to this condition. When we talk about recurrent pregnancy loss, we have to be mindful of the fact that there are forms of it. We have early pregnancy loss, where sometimes the woman gets pregnant and then she loses the pregnancy within the first trimester. The pregnancy is lost. And then we have the mid-pregnancy loss, where mid-trimester pregnancy loss, where some women lose their pregnancies between the gestation of about 16 weeks and above, 20 weeks and above, and that is mid-trimester pregnancy loss. Then we have those who lose their pregnancies in the late stage gestation, and normally in the 3rd trimester, there are certain conditions that can also lead to recurrent pregnancy loss, which is late stage recurrent pregnancy loss. So we are looking at the causes of recurrent pregnancy loss in general, and that affects some women. And then we see what can be done to prevent the ones that are preventable. When it comes to early pregnancy loss, what are the causes of early pregnancy loss? Early pregnancy loss sometimes can occur when there is chromosomal abnormality of the egg of the woman, or maybe there is a chromosomal abnormality of the sperm of the man. That can lead to pregnancy loss in the early stages of the pregnancy. Sometimes there are these chromosomal abnormalities or genetic abnormalities of the sperm or the egg, which can result in non-viable pregnancy being formed. And when that happens, then there is a likelihood that the pregnancy can be lost within the first trimester. There's also the issue of sometimes certain conditions like uncontrolled high blood pressure, in a woman, or uncontrolled diabetes. Normally, when a woman has high blood pressure or high blood sugar level and it is not well controlled, the risk of losing pregnancies in the early stages is very high. That is why when a woman is trying to conceive, one of the things that we look out is to check to make sure that her BP is well controlled, her blood sugar is well controlled, so that it doesn't lead to pregnancy losses. There is also the case of sometimes lifestyle issues, like women who drink alcohol or women who smoke. Sometimes these are risk factors that can lead to the loss of pregnancies in the early stages of the pregnancy. So this is something that we must be mindful and then take note of. The other thing too is that sometimes you can have certain medications that can have effects on the pregnancy in the early stages. For example, anti-malaria medications and some other medications. If you are not careful and then you want to get pregnant and maybe you are not aware that these medications can affect the pregnancy, if you are not careful, when you get pregnant, the effects of this medication can cause the pregnancy to be lost. So if you want to achieve conception, one of the things you need to find out from your doctor is that which medication should you avoid so that you don't end up terminating your pregnancy in the early stages when you don't want to. And then when you look at the mid-trimester pregnancy loss, sometimes it may be due to abnormal growths within the uterus. So for example, if you have women who have uterine fibroids, or they have other conditions like uterine polyps, which also sort of takes space within the uterus, sometimes that can lead to pregnancy loss in the mid-trimester. And there are those who have weak cervix. When you take the cervix is the opening or the entrance into the womb. Sometimes it can become weak. And so when the pregnancy is progressing, the baby is developing, sometimes the weight of the baby becomes more than what the cervix can hold, and then that may give way and then cause the pregnancy to be lost. So you can have weak cervix or incompetent cervix that can lead to pregnancy loss in the mid-trimester. And then sometimes too, we have women who have certain conditions with the ovaries, like polycystic ovaries and all that. So when you have ovarian disorders like polycystic ovarian syndrome or ovarian cyst and all that, sometimes there is a risk that you can also lose your pregnancy. So that is something we must also take note of. If you have that condition, you have to be treated and managed well so that when you conceive, you don't lose your pregnancies. There are other medical conditions like thyroid conditions like hypothyroidism, hyperthyroidism, and then other conditions, bleeding disorders and all that, that can also lead to pregnancy losses in the mid-trimester and even in the other stages of the pregnancy and all that. Then there are those who lose their pregnancy sometimes as a result of obstetric emergencies like placenta previa or placental abruptio and other emergencies that can lead to the loss of the pregnancy. And so when a woman is pregnant and you notice that you begin to spot bleeding and all that, or you notice that there is leakage of fluid from the uterus and all that, you need to report to your doctor for an assessment to be made, so that if any condition is going on that is threatening the existence of the pregnancy, quickly it can be arrested so that your pregnancy can go to full term. There are those who also lose their pregnancy because sometimes they get infections, urinary tract infections, or sometimes even malaria and all that. And so if you have urinary tract infections, which is caused by microorganisms like bacteria and all that, that can also threaten the development of a pregnancy and can lead to pregnancy losses. And so let's take note. If you are pregnant and you notice vaginal discharge that comes with bad smell, or that comes with foul odor, or you notice that there are some fluid leakages and all that, you need to report quickly for an assessment to be made so that treatment can be given you if it is an infection, so that as quickly as possible it can be taken care of, and then the pregnancy can progress to full term. And so recurrent pregnancy loss, there are instances where you may not be able to find out the cause of the pregnancy loss, and these are unexplainable situations. But sometimes the woman can go on to conceive again and be able to carry the pregnancy to full term. And so these are some of the few things that we can look at concerning recurrent pregnancy loss. Now let me also give this word of caution to women, prospective women who want to get pregnant. If you want to conceive, there are a few things you need to avoid. One has to do with caffeine products. What happens is that when you take caffeine products in the early stages of your pregnancy, it can threaten the pregnancy and lead to pregnancy losses. So we always advise that avoid the intake of products that has caffeine in it, so that you don't end up causing pregnancy losses, especially in the early stages. Well, our time is up. We'll be coming your way again. My name is Dr. Fiao from the Zoe Fertility and Alternative Medical Center. Bye-bye.
What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at Adenta New Site, behind the CAF International School, opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolizi Hotel, behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.